Hello and welcome to the Occupational English Test, otherwise known as OET. This training video is on the speaking subtest and it is specifically for dentists. You will be given 20 minutes. You need to talk to the interlocutor for 5 minutes. This is the warm-up session where you will be asked personal questions. Following this, you will be given a role play card and 2 to 3 minutes for preparation. Once you're done with your preparation, your role play will commence. This will go on for about 5 minutes. Once you are done, you will be given a second role play card and the same procedure will be repeated. So basically, you will be given 2 role plays specific to your healthcare profession. This session is recorded and scored by 2 different examiners. This test is a face-to-face examination. It will be between the interlocutor and you. The interlocutor will play the role of the patient or the carer, while you will play the role specific to your healthcare profession. Now, this is how the speaking is assessed in OET 2.0. These are the total marks scored by you divided by 39, which is a result of 24 plus 15 into 500. Whatever score you get is then converted into the grade. On this side, you have your linguistic criteria. The first one is intelligibility, which basically means speaking with clarity in a way that is understood by the other person. The next criteria is fluency, speaking without pausing too much or using too many fillers. The third criteria is appropriateness of language, which basically means that depending on the kind of task you are given on the card, you must use language according to that. And finally, resource of grammar and expression, which include all the important components of grammar, like sentence construction, proper usage of articles, tenses, proper words and phrases, etc. This is a total of 24 marks. For each criteria, you get 6 marks. On this side, you have the clinical communication criteria. The first point is relationship building. For this, you've got 3 marks. In fact, you've got 3 marks for all of these criteria. Relationship building talks about how you interact with the patient. Are you making the patient feel comfortable? What kind of words are you using? So all of these components are covered there. The next one is understanding and incorporating the patient's perspective. When you are doing the role play, you will be expected to use this particular aspect as well, instead of just assuming and suggesting or judging the patient. The next criteria is providing a structure. You must follow the structure given in the role play card. At the same time, you must tailor your responses based on the structure. Information gathering refers to how you get the information from the patient and what kind of information. And information giving refers to the solutions you will be providing to the patient or the carer. This comes up to a total of 15 marks. Let us look at the description of this type of question. You are given 1 role play card at a time. You will not be given the interlocutor's role play card, so you don't know what the interlocutor is going to say. You can only guess based on your card. The interlocutor's card will include information that is not included in your role play card. It gives you a good idea of the outline of the conversation. The role play cards will inform you of the key details about the patient. They also consist of the reasons for the patient's appointment. You need to take all of these pieces of information into consideration and plan your approach accordingly. Now, here are some strategies to answer this type of question. First, you must understand that this tests a real patient and health professional interaction scenario. This test is basically looking at the communication aspect and not specifically your medical knowledge. When you get the card, analyze the type of information given. If you have doubts, you must ask or clarify these doubts before beginning your 3 minutes prep time. Try not to memorize long answers. People often do that. You might not necessarily get the same card. Establishing a relationship with the patient, in this case the interlocutor who is posing as the patient, is very, very important. Make sure you ask for relevant information and do not include anything that is unnecessary, as this will just take up a lot of time and you will be completely off topic. Since this is the speaking test, there are some major factors that you must keep in mind. The first one is pronunciation. You must speak with correct pronunciation. You don't need to imitate a native accent, but your own accent must be very clear and pronounced. There should not be a hint of mother tongue influence. At the same time, when you're interacting with the patient, you shouldn't think about what you're going to say next, as you've already been given 3 minutes of preparation time. So make sure you use less fillers like or pause for a long time. Make sure you include all of the information, especially those given in the bullet points. If required, during the prep time, make notes on how you're going to ask these questions. Keep the context in mind, and by this I mean the setting. If you feel that certain keywords and phrases are important, or you can underline them and speaking, refer to them. Using a wide variety of vocabulary will give you an edge and increase your score in the linguistic criteria. Don't just stick to very simple phrases. Try to elaborate your question. Intonation and voice modulation is extremely important. Intonation basically is how your voice rises and which parts you're stressing on, how you're saying it. Voice modulation is again connected to the rise and fall. Like when you start a sentence, you speak with a rising tone. When you're ending, you speak with a falling tone. The ideas and examples given in your role play card should be said in full and complete and proper sentences, not in short bursts of phrases. Most importantly, remember to be confident and smile. Make eye contact with the examiner. Of course, you don't have to stare intensely or continuously, but make sure that you do not look distracted or at the walls or the tables or any other props present in the room. Take charge of the conversation and lead the conversation. As you can see, this is the interlocutor's card. The role given here is that of a carer. So the interlocutor will play the role of a carer, and this is the interlocutor's description or definition of whatever role he's going to play. This is the task. So when you are practicing in class, this is the role that your trainer will play, and further on in the final test, the role that the interlocutor will play. So if you are practicing with a speaking partner, get somebody to play this role. Now this is your card. This is your setting. This is your role, and these are the tasks given. Now you have to create your answer and your questions based on these pointers here. Make sure you don't just read them the way they are. You have to properly form notes in the first 2-3 minutes of practice time that is given to you. And you must take cues from what is being said, just like the strategy is mentioned above. And you must interact accordingly. You only have 5 minutes. This is your practice 2. Once again, you have your interlocutor's card. You will not be given the interlocutor's card, so you have no way of knowing what they are going to say. But this is for reference and for your practice in case you are practicing with a partner. This is what it looks like. As you can see, the setting, the patient. In the previous card, you will have noticed that it was the role of a carer. In this case, it is the patient directly. This is the task. These are the questions and the pointers the interlocutor will be putting across to you. The next one is practice 1, dentist's card number 2. As you can see, this is your suburban dental clinic. This is your setting. You are playing the role of a dentist. This is a description of the patient. These are the points on which you will be elaborating. So you have to take a cue from here, create notes on the basis of this, respond accordingly. Make sure you are leading the conversation. Now, to help you speak better and interact better, here are some helpful speaking phrases. Let's say you are starting a conversation. So you could say, "Hello, my name is Dr. Jane. Can I start with your name?" Or you could say, "Hello, come in. I am Dr. Jane. How are you feeling today?" You could also say, "Good evening, Mr. White. I see you have come for your review. Let us discuss your reports." Now you must keep the conversation moving at this particular point. How do you do that? You could use the following phrases. "Do you think that you would be comfortable wearing these braces? Or would you like to get some fillings to be on the safer side? It seems like you require root canal treatment for this issue. Would you like to know more about it?" Next, "I know that this could be frightening, but you must relax. We will work under local anesthesia." And finally, "This is a referred pain. May I explain this to you?" As you can see, these are different circumstances and different scenarios that a dentist could possibly face, especially when given the role play card. So these are some of the phrases that you could use. Now, the third point is ask questions to get the patient to talk. So if you're confused how to proceed, what to say next, the best thing to do is ask questions. So questions like, "Do your gums hurt a lot?" Or "Can you describe the pain to me?" Or "Which tooth is hurting right now?" Or "Is the pain acute or dull?" These are some of the questions that you could ask. Note the intonation and rise and fall. Your voice should be extremely endearing and pleasing, because dentistry is something that people often fear. People are often scared of going to the dentist. So you must be very engaging. The fourth point here is listen to the patient and adjust your language. You are talking to someone who has to decide on removing his or her wisdom tooth. Or you are talking to a young person who is getting their first set of braces. You could also be talking to someone who is morbidly scared of drilling. So how would your language change at this particular point? How would the words and intonation change? So practice speaking in different scenarios, keeping these questions in mind. Now here are some important words that you could use while practicing. They come in alphabetical order, but they are just a combination of different things or different words that generally come up or dentists normally use. There could be medical jargon. Remember one thing though, when you are explaining this to a patient, you must not use the exact word, you must further elaborate on what these mean. So one good thing to do is practice saying these words out aloud and in the form of sentences. Here's another set of words. Once again, ensure that you practice speaking them out aloud. You could use some of them to make sentences if it enables or enhances your writing as well, but make sure you speak them out. Now here are some techniques. So first and foremost, you need to understand who the patient is. For this, identify the type of patient, understand the patient's emotions, plan your approach accordingly. Next, interact with the patient. The second thing you need to do is to find out what exactly the problem is. So what do you need to find out? One, the problem. Next, look at your task and rephrase the points into appropriate questions. When you're speaking to the patient, begin with proper opening questions. And when you're finishing, do not finish abruptly. Instead, finish with the proper closed question. The third point is, what do you need to tell the patient on the basis of the information the patient gives you? First, inform the patient about all the necessary information related to the disease or the condition they are in. This will also include tests and course of treatment. Tailor your questions accordingly, and based on the patient's response, you must also respond accordingly. The fourth most important bit is English communication. Communicate confidently, take control of the interaction, ensure that you are leading the topic of conversation instead of the other way around. Avoid memorizing from old templates or previously done templates. Ensure that you are maintaining your fluency by avoiding fillers and pauses like and Fifth, the most important point is relationship building. Here, ask permission for uncomfortable topics from the patient. Once the patient tells you what the issue is, do not devalue or criticize them. Show them empathy. Make sure you elicit and explore the patient's concerns. Use the patient's cues to react accordingly. Here are some general speaking tips. First, what you could do is find an English speaking conversation partner and make sure you listen as well as speak. Use a mirror to see how you appear and whether your pronunciation is correct and the placing of the words in the mouth is correct. Record your practice conversation, go back, listen to it, correct the errors. Surround yourself with the English language, practice with music and movies. First without subtitles, then with them. Watch and listen to audio visuals in various accents. Practice reading aloud. If you do this on a regular basis, your speaking and communication will definitely improve. That is the end of this session. Thank you. All the best with your practice.